The COVID-19 pandemic has brought new challenges for healthcare providers, including the way teams work together and communicate. In today's podcast, the American Society of Anesthesiologists and the AHA's Physician Alliance have partnered to share experiences and lessons learned as a result of COVID-19. They're looking at how clinical and administrative leaders are working together to lead their teams through this crisis. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Senior Writer for AHA. In this episode, Elisa Arespacochaga, Vice President of AHA's Physician Alliance, is speaking with Dr. Gary Lloyd, Director of Perioperative Surgical Home and Anesthesiologist at Henry Ford Health System, and Robert Riney, President of Healthcare Operations and Chief Operating Officer at Henry Ford Health System.
Welcome to another podcast in the American Hospital Association's ongoing series where we focus on important issues facing clinician leaders. We're pleased to be partnering with the American Society of Anesthesiologists to bring you today's podcast. I'm Elisa Arespacochaga, Vice President of AHA's Physician Alliance, and today I'm joined by Dr. Gary Lloyd, Director of Perioperative Surgical Home and Anesthesiologist at Henry Ford Health System, and Robert Riney, President of Healthcare Operations and Chief Operating Officer at Henry Ford Health System. And we're going to have a conversation about their learnings and experiences as a result of COVID, and specifically talking and taking a look at the role of collaboration between their clinical and administrative leaders and teams to be able to care for their community more effectively. So to get us started, Gary, let me start with you to introduce yourself to my listeners and tell us about your role.
So my role usually is, as the Director of Perioperative Surgical Home, is to work towards getting silos broken down and to ensure that every patient gets the exact same high-level quality evidence-based care no matter who they see in the system, so that we get the best outcomes for the patients and at the same time tailoring to their individual needs. And it starts from the time of referral to the surgeon to the time that they get healthy after discharge. That's taken a whole new paradigm change in the COVID crisis.
Bob, can you tell folks a little bit about your role?
Sure. I'm responsible for operations for all of our hospitals, all of our ambulatory facilities, our retail-based operations, our community-based programs, and I work to ensure that we have the right alignment of goals, strategies, and tactics to continue fulfilling our mission.
Wonderful. So, Bob, how has the COVID crisis really impacted your healthcare system, and how did you prepare? You are in Detroit, one of the hardest hit areas outside of New York. How did you prepare?
Well, I've been in healthcare for 40 years. I've seen and been a part of weathering a lot of different storms, economic storms, regulatory changes, as well as just other health-related kind of crises that our community has faced. But I've never had the privilege of leading during anything that is as comprehensive and complex as what we have with COVID-19. And as you mentioned, Detroit has been an epicenter. And just to give you a little perspective, Henry Ford Health System has actually to date discharged almost 2,500 COVID positive patients, and unfortunately have seen 538 patients die while in our hospitals with COVID-19, and we are caring in total for over 7,000 COVID positive patients. So to say that this was a tsunami that came into our community would be an understatement. But I'm incredibly proud of how this organization has really handled this crisis and continues to handle this. And it starts with a base of teamwork. And fortunately, we've had a very strong collaborative model, and it's been part of our DNA. And boy, did we really see how important that was as we navigated through this. In fact, I've thought about health systems that may not have had that kind of team-based part of their culture that's very deep, and how challenging this would be. Because to be specific, we had to convert many of our medical surgical units to makeshift ICUs to accommodate the number of intensive care patients. We had to redeploy clinical staff and rely on great leadership like in anesthesiology to figure out how to provide services in a very, very different environment. And then we also had to deal with the opposite end of this, which is the shutting down of over 50% of our normal services and our normal revenue base. And so furloughing 3,000 employees at the same time that we had caregivers in our hospital settings working 16 hours a day, 7 days a week. So very, very challenging.
And Gary, can you tell us a little bit about how this affected your practice?
So the practice totally changed focus. So we had to redeploy. The surgical services went from within a few days, went down to time sensitive, and then a few days after that went to emergencies only because the tsunami was hitting with a huge wave. Administration was just fantastic. Our own epidemiologists were telling us that we were going to need probably about 100 new ICU beds, which within about 10 days were created out of thin air. And only because administration and everybody else put their heads together and figured how to do it. And to cover it clinically, we took our pain physicians who were also working part-time in the OR, put them in the OR, closed the pain clinics, moved all of our critical care physicians into the new ICUs, ramped up airway teams and ICU teams, moved all the residents into the ICUs. Half of the CRNAs reverted back to their critical care experience and provided critical care nursing because there wasn't extra critical care nurses to supply the ICUs. And we created 5 airway teams ultimately because that's what we ended up needing, plus procedure teams. The procedure teams were available to every ICU to free up the regular critical care physicians to work on the pulmonary aspects and the other pieces. And then we provided the procedures and putting in lines, arterial lines and central venous catheters and other things that they needed. And it was just kind of coordinated effort, and people pitched in, and I'm talking thousands of people in the system pitched in. People did overtime. Leadership was meeting 3 times a day and regularly communicating with the rest of us, and we were communicating back up. So there was multiple levels of leadership involved, and it worked pretty seamlessly. The communication was fantastic. Everybody felt like they were part of the solution and worked much harder. I worked a lot of night shifts, and 10 o'clock at night, I was still seeing communications coming through from administration. People just weren't going home. They were bending over backwards to try to achieve this huge need that we had to prepare for. And then when it hit, the epidemiologists were pretty darn close to what we needed to expect. And, creating those 100 new ICU beds and all the ventilators that had to come in and all the work that had to be done. And they took open air ICUs and sealed them off in plastic walls. And it was just an amazing thing to see, and everybody working together. But it was very exhausting, which leads to the other part. How do you prepare? And knowing that this was going to be stressful, there was a lot of preparation for the emotional impact that this was going to have on the providers. And that was rather significant.
I'm assuming, and we're going to continue to see that emotional impact for quite a while. I'm going to ask you to expand on that in a little bit. Let me ask you, Gary, can you share something that you're really proud of in your response to the COVID crisis at your organization? I would not be surprised if it was specifically thinking about the well-being of your team. What's the thing that when you look back, you're going to say, I'm really proud that we did this?
I am really proud of how we worked as a team. I mean, every aspect of the organization. I mean, it was people and did what they needed to do, learned all the new paradigm changes. Every day there was something new coming from the CDC. We had to change our practices, and we were telling each other what the newest things were, reinforcing when I would go in my spacesuit to intubate patients, we had to develop second spotters so that we could take off all that equipment in a protective manner, and then we would have spotters that would help us out and make sure everything was done appropriately. People just pitched in, and it was just make you feel with pride that many people would put that much effort in for not only the safety of the patients, but also the safety of each other. And that's what I'm most proud of.
That's wonderful. Bob, what about you? What's the thing that you're going to look back on with pride? I'm sure there are many things, but what's one?
There are many things, but I will tell you that it's the innovation. And I lost a very close friend who died to COVID-19 in one of our ICUs at the onset of this pandemic at 43 years old. So I got to see firsthand the extra effort that our team members went in to make sure that individual could have a connection with his family as he was clearly declining. And as you know, with a no visitor policy being required during a time like this, the stress on the patient, on the family member, and the care team was something that I don't think we even fully appreciated. And so innovation took place. And so in one of our hospitals, when they had to expand ICUs, they grabbed baby monitors and hooked up baby monitors so that there could be a connection to the team that was outside the protective area, and that they could send messages without having to gown up and regown every single time just to communicate, especially when PPE was short. And then because, as you can imagine, how intimidating it is to patients, especially those that may be on a ventilator of some sort, to have all staff that come in be in protective gear and look like they're in spacesuits and not really be able to see them. And so our Innovation Institute created a way to take large pictures of every team member and a sticker form and put them on the uniforms, on the protective equipment, so that they were interacting with the patient. The patient could see them. They could see them through a picture and know that that was who was taking care of them. So that's what I'm most proud of.
Well, I'm so sorry to hear about your loss, but I love the idea of using photos on their uniforms so that they could tell who it was who was working with them and helping them. Such a great idea. So, Bob, let me continue with you. I'm sure, again, there are many things that surprised you throughout this whole process, but is there something that you'd note that really surprised you about how this all happened, and specifically something that in hindsight you might do differently?
We launched incident commands quite quickly at all of our hospitals, and then we launched a system-wide incident command, and then an executive steering committee. And all of those functions operated 7 days a week, multiple times a day. And so while the structure was great, there was still a lack of clarity in those first couple of weeks as to what decisions should be made at a local hospital incident command, what should be made and escalated to the system-wide incident command, and then what things like HR policies, surge pay, should be elevated to an executive steering committee. And it took us a couple of weeks to get that rhythm. And so one of the things that I would change is to have a clearer playbook in place for those specific kinds of decision-making standpoints. And then the second thing that I would change, and I assume this would be a universal decision, is, the scramble for PPE during the first few weeks was not only scary, but very disheartening. Having the amount of stockpiled supplies within your own organization is something that I will really make sure happens in the future, because things break down outside of your control. And in spite of a lot of best efforts, we found ourselves, doing some incredibly creative things and relying on the community to donate PPE. And I don't want to put our staff in that position again.
You've definitely caught us all, I think, a little by surprise. Gary, something that surprised you that you might do differently in the future?
What surprised me the most was the severity of this disease and the amount of time it took for patients to recover. and the emotional impact it had on everybody. What I would do differently is try to be proactive on that emotional piece. I was on the front line and just did intubations for 3 weeks. And what was most horrifying was knowing that a third to a half of those patients that I was intubating, that my face was going to be the last one they were ever going to see. And the panic that was in their faces is like etched in my brain forever. And the amount of support that I was going to need personally, and then all of my colleagues, we talk about it all the time now. As one of the psychiatrists who's been helping us, she says that we're actually suffering through post-traumatic stress syndrome now, even though it's not over, and that we are all suffering, and the entire workforce is suffering the same way. So having those type of resources available and guiding through this and recognizing when your team members are struggling so that you can be flexible enough to help one another out, I think is extremely important. And that probably should have been implemented earlier than it was. But I'm very happy that it was recognized early, and they've done a really good job of trying to help everybody as we try to come out of this crisis and reestablish ourselves.
If I could add just one comment, because I think Gary raises a very important point. And one of the things that surprised me is the public really doesn't understand how little death actually occurs in hospitals other than through the emergency rooms with trauma and in controlled environments like hospice and inpatient hospice care. And deaths do occur, as we all know, across the enterprise. But I think the public was unaware of what a relatively small number that is, and therefore the devastating impact and emotional impact on caregivers when it became, you're losing 6, 8, 10 people a shift or a night. And so I just want to really emphasize the impact that that's had on our care team and our commitment to support them through this process, because that was not something that they were trained for, other than perhaps some individuals that had worked in active military hospitals.
I think that's a very good point. There's just a magnitude that hospitals that were in these epicenters got to experience that outside of military action, I don't know that anyone has really experienced at this level. So, Gary, can I ask you to expand a little bit about some of the resources that you all are working on to support your caregivers? I think it's important for folks to know how you're doing some of this work.
So what they initially rolled out, since we can't meet in person, were Zoom meetings that were at particular times that people could call into. We had a town hall meeting where people could vocalize. As you would expect, our department is about 50-50 male-female, but the females were participating about 3 times at the rate that the males were. And so we had several of the prominent men in the department, unofficial leaders, that talked about their stress and how this has affected their lives, both personally and professionally. And that did a lot to open up and allow the men who typically don't seek out such help to do so. And that's been rather rewarding. We're actively putting together multimodal approaches, because some people need to work this out in storytelling, some need to talk about it or display it in art, some people need to just do it in community. So we're setting up community lounges online where just within our own department, we can take the time to try to reestablish community, because while this is going on, many of us were estranged from our families. We put ourselves in quarantine. And so not only was it hard at work, but then it was also very difficult at home. And then our families were having to deal with that same isolation and seeing the fear. So we didn't get that nurturing from our family that we normally would, just because we wanted to keep them safe, and so we didn't want to bring anything home, and it was tough.
I can imagine, without having your home team to support you, in addition to the very difficult work challenges. So, Bob, let me ask you, what are some of the lessons you learned from how you work together as a team that you want to continue to perpetuate? That, you said at the beginning that this team really came together, and what are the things you want to make sure you hang on to and keep moving?
We're having that very discussion right now because, you certainly see your real character during a crisis like this, and you also see where decision-making happens in a way that maybe should become the new norm. And so we're looking at what types of decisions that we made under the circumstances of a crisis need to be just recognized as decisions that are meant to be made during special circumstances, but not the way to move forward. And then what decisions did we make in a quicker, more agile way during this crisis that really should become the new way of decision making, and what does that look like? So we're being, very, very purposeful about that work, and I think it's exciting work. We're also trying to find out what testing the true system integration strategy really meant to us, because we've always been very proud of our integrated health delivery system and the fact that we work together as a team. But, in a crisis, you also have some stress points that come out. And so we're examining those stress points to say, were there some structural things that actually aren't supporting the very type of organization that we want to be? And if so, then should we look at making some modifications to that? And those relate to structures, those relate to decision-making authority, and no major findings right now, but I just think it's a healthy process to go through that debrief and make sure that you're capturing these moments before they're lost.
When I came to Henry Ford, one of the things that I found most remarkable was the amount of trust and respect that was mutual, that had been built and was continuing to be built between leadership and providers and the rest of the organization. And that really got tested during this crisis. And I think it only got stronger. I really hold all of the administrators in higher esteem now than I had before, and it was pretty high before. I really feel like the organization has everybody's best interest in mind, and I just can't tell you how much building that trust and respect really will pay dividends, big dividends.
I heard a lot about trust, respect, and teamwork, and really a lot of caring across the organization. So, Gary, let me start with you on this last question of what's the advice you would give to your colleagues at institutions where either hopefully they haven't and won't experience the kind of peak that you did, but as they think about other things that may come their way, how to really prepare for this type of experience? What's your advice?
My advice is to prepare for the worst. You may not have to implement all the pieces, but understand what you would have to do to meet the demand. Don't underestimate what impact this is going to have on your own people. We had dozens of our own staff who became infected either through work or through the community, who were then sidelined and were not able to participate. And so then those were resources that we couldn't rely on, and we had to be able to be flexible enough and fill in. Our work schedules changed every other day, and so assignments were just kind of crazy. And so you have to prepare to be able to be that flexible and have backup systems worked out. What I witnessed was that it was almost like they were going through a failure mode effect analysis in their preparations for this COVID virus, and we frequently had to go to Plan B and Plan C. And I would urge other institutions to work on making those preparations. And if it comes as a tsunami, you've only got days to put it in place.
Bob, how about you? Advice you'd give to your colleagues across the nation?
The first thing I would tell them is emergency preparedness and disaster preparedness drills are not a bureaucratic exercise. They're really a requirement. I would take them extremely seriously and make sure as leaders that you're leading by example and showing how important that they are. The second thing would be what I mentioned earlier about supply chain. Make sure that you have contingencies if you're faced with a supply crisis the way many of us found ourselves. And the third thing I would say, if you haven't established a culture of transparency, you need to do it now. Because when all's said and done, I think the transparent culture and authentic commitment of leaders in this organization really helped create a intolerable environment in many ways to become relatively stable. And so we made a point that we were going to be very transparent with all team members, and we were going to share the good, the bad, and the ugly. And so when we had record numbers of employees test positive themselves, we were very public about that with our team members as well as the community at large. And not all health systems took that stance, but respect comes from knowing that you're not hiding things. And when we lost our own employees to COVID-19, we were very transparent about that, and we shared our collective grief. And we also were very transparent about the victories. You know, you have to infuse organizations with optimism when there's so much draining them. And so our daily stories of our heroes, some of the ways community was stepping up, we made sure our employees not only knew that, but they felt that. So those things in combination would be some of my key messages to my colleagues that haven't yet experienced something like this.
Well, I just want to say thank you to both of you for not only the amazing care you took of the community in Detroit, but for taking the time to share with us all of the great lessons, you know, the years of work to build your team and to build your organization to be able to weather this crisis. I'm in awe of being able to talk with you guys.
Thank you.
Thank you very much.